Hello and a warm welcome to all of you to this webinar. We will just give just a minute or so for others to join in, and then we'll get started. Good morning, good afternoon, and good evening. Thank you so much for making the time to join us here at EGPAF on this fourth installment of our Evidence to Action webinar series for this year. My name is Tsitsi Chatora. I'm a technical advisor with our external technical assistance team here at EGPAF, and we're really excited to have you on board as we tackle a topic that is of great importance today more than ever, linked to the need that we have to really ensure that we improve our health systems so that we ensure that there is quality care for the populations that we serve. So our topic for today will be a focus on innovations that we've had here at EGPAF in technical assistance, with a specific focus on strengthening local capacity for sustainable, responsive, and resilient public health systems. Next slide, please. So I will just briefly take you through the agenda for today, and then a few housekeeping notes for you to make the best out of your experience with this webinar today. We have lined up 4 panelists to really help us tackle this topic of strengthening local capacity as well as program optimization. First on our panel is Ivan Teri. He's an Associate Director for Program Optimization here at EGPAF. He will be giving us, some insights, lessons learned, and just charting the way forward in terms of program optimization work that we're doing at EGPAF. He will be followed by Tsepang Mhlomi. She's a Country Director for one of our largest programs within the EGPAF portfolio. She will be sharing insights on the local capacity strengthening work that is being done in Lesotho. And indeed, we are privileged to also have, as part of our panel, Ntate Maime Nkoto. He's a nursing services manager at Mamohao Hospital. Why he is part of this panel is because he would represent recipients of some of the technical assistance that we're providing to local partners. The institution that is a services manager of is the Christian Health Association of Lesotho. Basically runs this institution. So this is one of the organizations that we are supporting. So we're really excited to have, as part of our discussion today, insights from the perspective of Ntate Maime as a recipient of the technical support that we're providing. And then a fourth panelist is Jane Macha, who's a technical advisor for system strengthening based in Tanzania, also providing great information around some of the work that we are doing in Tanzania. So each of our panelists will have about 10 minutes to go through their presentations, and then we have dedicated the last 10 minutes of this webinar to address questions and have further discussions and comments regarding this topic. So we're really hoping for a highly engaged, interactive time towards the end of this webinar. Next slide, please, Nick. So in terms of housekeeping, we really are eager to know who you are, excited to have you join us in the conversation today. Please go ahead and introduce yourself using the chat feature at the bottom of your screen. So let us know who you are, where you work, perhaps what you do as well, in terms of your title and so forth. So we really get to know who it is that we are having this conversation with. Please submit your questions and comments using the Q&A feature at the bottom of the screen. The panelists will respond during or after the webinar. And then please also note that this webinar is being live streamed and recorded, and we will be sure to share the recording at the conclusion of this webinar. So I believe my job here is done. Really excited to have our first panelist share with us our experiences as EGPAF in terms of program optimization. So over to you, Ivan.
Thank you so much, Tsitsi. Thanks for that wonderful introduction. Hi, everyone. I will be talking about our program optimization work at EGPAF and how we have used it to improve our effectiveness and efficiency in HIV programs as well. As Tsitsi mentioned, I'm the Associate Director sitting here in Washington, D.C., and working with a number of colleagues, both globally and in countries, to really look at ways to strengthen our HIV programs. Next slide, please. So for more than 30 years, EGPAF has been leading and working with different partners in the global fight for HIV/AIDS, with this particular focus on pediatric HIV/AIDS. The epidemic has been complex, it has been evolving. And as with many stakeholders, we realized we need to continuously optimize our programs and services to maximize their quality as well as their impact. So we, among other solutions, we do apply various standardized and iterative approaches that really help us to use proven quality improvement methodologies, improvement science as well. And that allows us to really enhance program design from the outset, ensure that we have the right tools, resources, people in place in order to then implement high quality programs. And in the end, not ensure that there's some sustainability there as well once we identify best practices that we can spread. Next slide, please. Key to our work is leveraging national, regional, global expertise and resources. So we have a global network of staff experts and technical resources that provide really high quality support. In terms of optimization specifically, we have more than 11 EGPAF countries who are implementing these optimization solutions that I'll share with you today that support national HIV and TB programs. We have dedicated QI and program optimization leads in 8 countries, but we also have many more staff who are really adept and have expertise in continuously improving, continuously assessing HIV programs and continuously putting in solutions that are hopefully sustainable as well as impactful and create positive health outcomes for our members. And most of these solutions are usually locally led approaches. As anyone who knows improvement science, it's really working with the folks who have that knowledge within them and really guiding them to come up with tailored but adaptable solutions within their own resources. And this usually maximizes our responsiveness and effectiveness as well. Next slide. Today, I'll feature 4 of our solutions: quality assessments, quality improvement, client satisfaction and community engagement, as well as program optimization. Next slide. So in terms of quality assessments, this is the beginning. This is the evidence generation. This is where we want to understand the problem. We really work hand in hand with healthcare providers, healthcare managers to routinely assess the quality of care. Typically by a twofold approach. So one is analyzing routinely collected data using the systems that exist. typically aggregate data. We identify strengths, gaps, areas that require further investigation, and also where we can actually have impactful intervention. The other one is really deep diving into patient-level data, abstracting that data using internationally recognized quality of care indicators, and then really assessing the performance. How are we really treating each individual client? So really looking at that patient-centered care. And we use then various tools to really look at the root causes of some of the gaps that we identify, and then begin to implement quality improvement projects. So there, as a screenshot, you see recently migrated a quality assessment tool that we in-house call EasyQI, that really enables us to do many of those patient level abstractions. And it's a mobile DHIS2 based and web-based application that really allows us to pinpoint clinical quality of care issues and then start addressing them with the next slide, with the next solution, which is quality improvement. Many of us are familiar with quality improvement. We have been working hand in hand with ministries of health for a long time, both providing TA, but more partnering with their national QA programs, and using those programs to ensure that there's a spread in terms of mentorship, coaching, tailored approaches for analysis, feedback, and dissemination at different levels of the national system. So we've very much focused not just at the national level, but regional, provincial, county, as well as facility level. Most of our approaches are based off of the theoretical underpinning of the PDSA, Plan, Do, Study, Act approach. We then use that to formulate and work with different teams to help them formulate QI projects. And we also really promote QI collaboratives. So part of that is we ensure that using PDSA and using collaboratives, we work with the different levels that I've mentioned. And by providing TA and technical assistance to those different levels, we then come up with solutions that we hope are, one, not just high quality, but are able to be sustained over time and are locally owned and driven by the different levels as well. So there's an element of co-creation. We include including our partners in the various countries. Like recently, we had a QI collaborative in Malawi that under the Gates Award that really included multiple partners who work together diligently on advanced HIV disease. And this is really in the hope of accelerating these solutions and to scale, especially. Next slide, please. So client satisfaction and the client voice, as well as the community voice, are equally as important in the work that we do. EGPAF really appreciates the intersectionality of the client's voice with the QI work that we do at the health facility level. So we really have a commitment to engaging communities. We have a commitment to engaging patients in all the steps of quality assurance, in all the steps of quality improvement as well. And we've drawn upon human-centered design principles, and those really help us to really listen and understand, and then use that learning to really work with the healthcare workers to provide better quality services. So we work with, we really try to also strengthen the feedback mechanisms, especially at a facility by facility level, to really understand for your facility, for your catchment area, how is your community here? What are their behaviors? What are the various factors that we should take into consideration? And then we create solutions based off of that, according to national and international standards as well. And we believe that when you empower the clients, you then have these collective voices as drivers for action, and then you hopefully have stronger quality of services, and then obviously improved health outcomes to follow as well. And on the right-hand side just shows our model, enhancing the patient's voice in quality improvement. And the presentation has links to a lot of this information for your further perusal. Next slide, please. One of the last approach I'll cover is the program optimization approach. This is a 5-step iterative approach that EGPAF has developed and tailored, again, based on underpinnings of improvement science, as well as the plan, do, study, act cycle. So this is a 5 core steps that can be applied at the program level with activities and services as well. So this approach, the program optimization approach, really serves to advance tailored partnership-driven solutions. So it brings partners at different levels, not just at the site level. So quality improvement is very much a site level initiative. Program optimization really brings different partners together at the project level, program level, within the districts and the national level. And this collaboration, then, we're hoping to advance equity, ownership, and accountability to really ensure that we're taking ownership of the solutions that we have come up with together as a partnership. And then we're really driving those and ensuring that there's a sustained, we sustain our gains as well. So on the right-hand side, and on the link below, if you click on it later on when the slides are shared, you can see more information on work that we've done in Mozambique to improve isoniazid preventative therapy, and also the approach that we used to improve HIV viral load testing at spoke sites in Tanzania. Just to note that this approach can also be used for operational, and is frequently used for operational elements as well, including payments to sub-grantees, vehicle management, and other areas. Next slide. Last but not least, we embrace digital health. We understand that quality and digital health have an even larger intersection. So we really try to integrate technology and improvement science so we can better understand first, and then strengthen services for children, mothers, and families affected by HIV/AIDS. So EGPAF has many, actually, digital health solutions led by our digital health team. For improvement science, we mainly lean on 4 of them. One is the quality assessment tool that I shared earlier. There's a tool that really tracks our quality improvement projects. There's one that tracks our program optimization projects and manages those. And there's also one that really looks at our TA that we're delivering at the site level and really forces us to ask ourselves, are we targeting our technical assistants? Make sure that we're really hitting the nail on the head and ensuring that each of our site visits and each of our mentorship visits are really targeted, have of high quality, and actually produce some long-lasting outcomes, not just for the healthcare center, but also the patients that we're visiting. Next slide. So what's on the horizon for this work? We definitely are trying to create more efficiencies, and part of creating efficiencies and sustainability is going to be through integration. So we want to use improvement science and quality improvement and the other solutions that I've shared to really see how we can integrate cervical cancer, non-communicable diseases, triple elimination into our programming. The other area is global health security, which is becoming more and more key. We see that we need to be more prepared for epidemics. We need to have stronger and more resilient health systems. So how do we use these elements to also strengthen our health systems and make them resilient as well? And also exploring things like climate change that are coming up more and more. We want to use the implementation science to double down on some of the gaps that we see. We still see children are left behind. We're still focusing on advanced HIV disease and treatment failure and drug resistance. So all those areas are also key focus areas that we really want to ramp up over the next couple of months and years. But lastly, as we're talking about transition and localization, we also want to use these solutions to be part of the solution on how we support sustainable leadership, how we maintain high quality services, how we maintain accountability before, during, and after a transition as well. So that's really a focus of our area. Thank you for listening, and I'll hand it over to Tsepang. But wanted to acknowledge all the staff that are working diligently, immensely long hours, and with great results, both at EGPAF, within our donors, our ministries of health, and our implementing partners. Thank you.
Thank you, Ivan. So good morning and good afternoon to everyone. I'm excited to share with you all the Lesotho program journey in the capacity strengthening of local partners as part of our external technical assistance work. Next slide, please. EGPAF in Lesotho implement an HIV and TB care and treatment program. As outlined on the slide, the EGPAF HIV program interventions are nested on the UNAIDS 95-95-95 goals, starting with HIV testing efforts, care treatment, patient management to achieve viral suppression. We are excited that Lesotho is on track to reach the 95-95-95 goals by 2025 and is on the cusp of epidemic control. We conduct several internal technical assistance activities to support the Ministry of Health HIV and TB program implementation. Towards sustainability and planning efforts, EGPAF also supports external technical assistance to civil society organizations. As highlighted on the slide, my focus today will be on the programmatic clinical quality improvement and strategic information and evaluation technical assistance to local partners, including the Christian Health Association of Lesotho, which has joined us today. Next slide, please. Starting in 2016, through the USAID-funded AIDS-Free project, EGPAF started to provide external technical assistance to civil society organizations in Lesotho. The purpose of the project was to increase uptake and quality of prevention of mother-to-child transmission services, pediatric and adolescent services, very much aligned to our mission. At the time, we conducted assessments of several civil society organizations and adopted a phased approach towards the external technical assistance to umbrella organizations, starting with the Network of AIDS Service Organizations, LENASO, and the Network of People Living with HIV and AIDS, LENEPWA, followed by two key populations organizations, Care for Basotho and Matrix, and last but not least, the National AIDS Commission. The technical assistance focus was on several program areas as outlined. For example, prevention of mother-to-child transmission services, HIV testing services, TB and HIV, nutritional assessments, and gender-based violence. EGPAF also supported development of demand creation and mobilization messages, advocacy and communication plans, as well as strategic documents like M&E frameworks, but also governance documents, including training of board members. Following identifying gaps during the second phase, human resource deployments were made to strengthen the functioning of some of the civil society organizations, like the key populations organizations that I mentioned, as well as the National AIDS Commission. Next slide, please. Through UNITAID support, EGPAF in Lesotho provided external capacity strengthening to civil society organizations and media on the importance of early infant diagnosis. We supported development and printing of the ART treatment literacy booklet for caregivers and conducted trainings of civil society organizations on advocacy for the introduction of pediatric DTG 10 milligrams. Through partnership, we also worked with the Community Advisory Board in their advocacy and treatment literacy efforts. Next slide, please. As part of the USAID-supported PUSH project, in 2019, we started to support USAID localization efforts through external technical assistance to 15 civil society organizations, as listed on the right-hand side of the slide. External technical assistance to the Christian Health Association of Lesotho was commissioned in 2021-2022 fiscal year. And this constitutes the CHAL Secretariat and its chain of hospitals. And it is important to highlight the importance of CHAL in the landscape of the health system in Lesotho, as they provide services to over 40% of the population. A colleague from CHAL will be sharing his experience, so I will not talk about this intervention. The external technical assistance focused on clinical, programmatic, and technical areas. Next slide, please. This slide outlines the framework for the technical assistance to the civil society organizations and CHAL. Starting with developing the legal framework, such as the Memorandum of Understanding with local prime partners and service level agreements with sub-awards. This followed by collaborative technical capacity assessments that inform development of capacity development and technical assistance plans. Toolkits are then developed to guide the capacity building activities. And the TA also covers strengthening of local partners in monitoring and evaluation and quality assurance and quality improvement systems. Reviews are then conducted progressively to inform when an implementing partner is ready to graduate or when it is ready to exit the entire technical assistance portfolio. Next slide, please. So just wrapping up by sharing these 4 pillars that guide the focus of our technical assistance work. That is trainings, advocacy, and networking, and using centers of excellence for continued learning. It is important to highlight the supportive supervision and mentorship to complete the efforts that we provide. This will be my last slide, and I will hand over to our colleague from CHAL, Ndadima Ime, over to you. Thank you.
Good afternoon, everyone. My name is Maime Nkhoto, Manager Hospital Nursing Services at Mamha Hospital. As we can see at this first slide, we were having one of the technical assistance training to our team here at Mamha. Next slide, please. Okay, before we can go any further, I will introduce Mamha Hospital so that we understand what are we about when we talk about Mamha Hospital. Mamha Hospital is one of the Catholic hospitals and one of the Christian Health Association of Lesotho health facilities. It is based in the outskirts and most rural areas of Leribe. As we can see on the map, this is a Lesotho map. The red indicated MH is where Mamha Hospital is located within Leribe district. So Mamha Hospital serves a population of about 9,774 people. And it is one of the best performing hospitals when it comes to ART, mother and child health services. So we started to work with EGPAF since 2008, and EGPAF was supporting the following areas: implementation of quality HIV services, including PMTCT, TB, HIV, ART, and all the services that are HIV related. Health system support. We have been receiving support from EGPAF for procurement of POC, DNA, PCR machine for the test of children, and BP machines as well, and also some improvements in the pediatric wards. Next slide, please. So when we talk about technical assistance support, Mom Hospital has been receiving focused technical assistance from EGPAF since October 2001. And the support started with EGPAF engaging Mom House on the following areas. Firstly, we as Mom Hospital, we started first to understand the scope of TCA, TA team from EGPAF, and also EGPAF as well, doing the same, understanding the scope of Mom House, as that is a key building, that build a key open and honest relationship that is required for technical assistance provision. And it is during that stage that the process of TA provision was explained to us as Mom Hospital team. The initial engagement of enabled us whereby EGPAF explained or introduced a relevant tool which is going to be used to assess us as the hospital for technical assistance. Next slide, please. So now we come to the implementation of TA, which is technical assistance process. Initial step, conducting technical capacity assessment. During this stage, EGPAF shares the TCA tool, following the presentation of this tool so that we understand how to complete the tools for assessment. And then we are being given a chance to self-assess ourselves, to internally assess ourselves as a facility, so that when the joint assessment comes, we are conversant with the areas of the assessment tool. So this self-assessment helped us as a facility because we were able to meet as different departments and introspect, and that also helped to improve understanding what was happening or what is really happening in other departments, so that we're able to work together as a team. So during joint assessment, EGPAF the self-assessment tool that we have completed as an organization, then verifies the scores so that we end up agreeing on the assessments together as an organization and as a team. So based on the developments that have been said, the TCA team will the analysis report whereby the identified gaps are being prioritized. Then we sit down as a team to see how best we can address those prioritized gaps so that we are able to address them. So as we talk now, we have received 2 technical assistance assessments whereby Mom Hospital has attained first level of graduation on monitoring and evaluation, as well as quality assurance and quality improvement. Next slide, please. Next slide, please. So step 2, addressing the identified gaps. To address the identified gaps, EGPAF has used different strategies, including trainings whereby face-to-face trainings were conducted, as well as visual trainings. They were also doing supportive supervision as well as mentorship sessions, and trainings are conducted using training of trainers models, whereby our QI team would be trained, and after being trained, they go down to those step-down training to other staff members, so that we are at the same level of information. So to date, several trainings have been conducted for Mom Hospital as follows. For HIV services, we have been trained on advanced HIV disease, revised ART and EMTCT guidelines, exposed infant diagnosis, treatment failure, and viral load suppression. So when it comes to wraparound health services, we are being trained on gender-based violence and post-gender-based violence services. We're also trained on cervical cancer screening as well as human papilloma virus. Stigma and discrimination related to HIV, TB training, including scorecards, trained on nutrition, implementation of clinical standards and standard operating procedures under TB, and finally on customer care so that we are able to improve the care of our customers when they came to our facility. So on the project management as a facility, we were trained on facilitation and mentorship skills. And we were able to do step-down trainings because we were trained as a QI team. Then following that, as I explained, we disseminated this information to our fellow colleagues. We were also trained on maternal and child health, focusing on resuscitation of the newborn. Most importantly, we were trained on quality improvement and quality assurance, and also trained on how to develop QI plans so that we are able to plan accordingly, so that we'll be able to develop our QI projects. So we were also trained on monitoring and evaluation, including data use and visualization, so that we are able to use our data, so that it also informs us, so that we act accordingly. We were also trained on success stories, so that as an organization, we are able to write stories on the areas where we have succeeded as a facility. And also research training, so that we are able to research as an organization. Then trained again on identification of training needs and conducting step-down trainings. This was a very important training because it helped us to identify the training needs of our fellow colleagues so that we are able to train on the targeted areas so that we are able to improve our services. Development of appropriate service delivery standard. And lastly, we were trained on emotional intelligence for leaders and managers. This was very important as well because it helped us to be able to manage our emotions and emotions of other people around us, as well as our clients. Next slide, please. So step number 3 talks about monitoring and evaluation of technical assistance efforts. So EGPAF continues to monitor the TA's efforts and their sustainability through continuous engagement. And this continuous engagement, we are being given a support supervision and being mentored accordingly. And there is also a reporting tool that has been decided by TA team, whereby we report on a quarterly basis based on all the activities that have been done throughout the quarter. So we also receive one-on-one quarterly review meetings with TA team to address some of the challenges that have been identified. So we also conduct annual TCAs to determine hospital transition to graduation level. And apart from TA team, we also receive supportive supervision from EGPAF district team based at the Ribe district. So they come on monthly basis to support us as an organization. Next slide, please. Next slide, please. So these are the benefits that we have gained from the EGPAF TA team. Improved documentation. Initially, we have been conducting most activities, but unfortunately, documentation was not that good. But following introduction of TA, we have seen much improvement in our documentation because, for example, now we are able to document the patients that have been referred in other facilities for other services. So again, the documentation has improved our communication because when documentation has been done well, we are able to comprehend whatever the information that has been done or delivered to our patients, and also helped in ease of reference. And also documentation improved in the orientation of our new staff and also of our implementing partners. We are able to document the orientation process so that we see how many patients, staff members that gone through orientation and which areas that they were oriented on. So when it comes to development and implementation of documents, through the trainings of technical assistance team, we have developed a plan as I indicated earlier, and from those quality improvement, QI plan, we are able to develop our QI project so that we are able to improve some of the indicators that we are not performing well at. And also we managed to develop a checklist for supportive supervision for our own SD facility so that we are able to supervise our departments accordingly. And we also managed to develop standard operating procedures as well as service delivery standards. So when it comes to improved use of data for decision making, as I indicated as well, we are able to document data use and to visualize our data so that we are able to, data is able to communicate well with us. And also the strategies to address gaps or weaknesses in data exist. This ensures realizable data collection to enable use for decision making. Improved team spirit and coordination. The internal TCA has improved collaboration among all departments and supporting one another, because as I indicated as well, we are able to sit down as a department, and during those meetings we are able to complement whatever services that are being done in other departments, and also learn best practices from each other and from other different departments, improve communication among departments, as I said. Improved capacity. Improved facilitation and mentorship skills is one of the trainings that I mentioned earlier. Ability to develop success stories as well as improved customer care. Improvement in general program performance. For an example, we have attained indicators such as cervical cancer screening. We were not performing well in this area, but since engagement of TA team, we have seen much improvement, as well as in TB and other departments as well. Next. Okay, by all saying, I'd like to thank everyone for listening to this presentation. Thank you.
Hi everyone, this is Jane Macha from EGPAF, a technical advisor, health system strengthening. Next. I'm going to talk to you about approaches to strengthen our local capacity in Tanzania. In my presentation, I'll focus on two areas or approaches we are using: regional acceleration strategy, district approach, and engagement with community structure, as well as lesson learned. Next. Next, please. Yeah, in our current program, we are implementing in 6 regions, as you can see: Arusha, Dodoma, Kilimanjaro, Manyara, Singida, and Tabora. And scope of our program is HIV, tuberculosis, and family planning. Next. Yes, I just want to explain on how we are working in the health system structure, especially at the local government authority. At the region, we do work with the regional health management team, and at the district or council, we work with council health management teams. At facility, we work with health facility management teams and community health workers. Next, please. Yeah, so we have implementation approaches we are using to strengthen our local capacity to enhance ownership of our program. So next. So one of the approach we are using is called regional acceleration strategy. This is our innovative approach. That is, we are using it to identify specific regional priorities, gaps, and develop a specific action plan to support implementation, monitor, and report. As well as for the RAS implementation, our greater emphasis is involvement of regional leadership, which is RHMT. That means we are putting RHMT in the driving seat for them and us to jointly plan of intervention, for jointly implementation, and jointly review, evaluate, and disseminate lesson learned at the regional level. RAS is our enhanced approach, whereby we are providing hands-on support for service delivery and focus on case management approach at site level. Our RAS approach is normally focusing on data-driven implementation approach, and we do focus on the areas where there is a greatest need and to ensure quality of integrated service delivery. In our RAS approach, we conduct weekly meetings and monthly meetings to discuss our performance at the regional level. Next. Next. Yeah, this is our organizational structure for our RAS in our regions. As I said, we have RAS, we're implementing RAS approach in all our regions. And we have our consortium partners whereby they're also allocated in our RAS teams. We are planning and implementing through one structure, one team, one plan, whereby in each region there is a RAS team to work with the regional leadership to make sure that we are coordinating implementation at the regional level. Through our 6 regions, as I said, we have leaders who are regional managers who are coordinating the RAS approach at the regional level. Next. Next, please. Yes, how did we form RAS? As I said, RAS is a case management approach. Our RAS approach is formed from the country office level. Teams are joining the regional teams, and we form the case management teams. And these teams are always going to visit facilities jointly with the regional management teams. We conduct visits, we conduct visual site support through different modalities, through Zoom, WhatsApp messages, and other modalities. And we also support CHMTs and district mentors to ensure that we are really implementing or addressing issues at the regional level. Our focus is Tier 1 and Tier 2, and our visit is really driven by key indicators like index testing, continuity of treatment, and other key indicators as well. So this is one of our main approach we are using. We have another approach. Next. Another approach is the district approach. District approach and the RAS approach are complementing each other. And we are applying this in a different purpose, but the first one, RAS, is really focusing to build the capacity of regions. And this one is really focusing on CHMT level. So why are we using district approach, EGPAF? We decided to use this approach because we wanted to decentralize the resources and the authority to empower local government authorities. As I mentioned earlier, council health management teams, to help them to manage program activities at their respective councils. Our greater involvement teams in this area are, CHMTs. We are working collaboratively with them to make sure that we are planning together. We are coordinating implementation of various service delivery model. We are also monitoring and reporting of project progress. The approach of district approach is really promoting transfer of capacity, management, and oversight of activities to local government authorities. We are also promoting efficiency and advanced ownership and the sustainability of project activities. So RAS, district approach and RAS approach are our best model for implementation in our EGPAF region for now. Next. Next. Next, Nick. Next. Yeah, in our district approach, What we do, we normally plan and develop plans through council health, comprehensive health plan, we call it CCHP. Our project scope priorities target for 1 year and ceiling and shared during CCHP planning. EGPAF support RHMTs and to incorporate project activities in the region and council plans. They finalize the approved plans and budget uploaded to the government's accounting system. And EGPAF and CHMT, we normally plan together for implementation. This allows councils to allocate resources where they are mostly needed. Next. Go to the next slide, please. We also build the capacity of frontline healthcare workers, and we conduct a classroom training, and we develop a pool of mentors. So far for this year, last year we managed to develop more than 400 mentors to support intervention at different areas. Next. For capacity building, you can see we conducted significant number of training of healthcare providers to different regions. Next. For service delivery, what we are doing to ensure sustainability, we integrated project activities into healthcare facilities, for example, family planning in HIV testing in reproductive child health and others. Coordination of activity at the facility level is coordinated by government facility staff who are really overseeing implementation at our CTCs and other clinics. As a project team, we are supporting facilities to take ownership of the project interventions. We are also linking government initiative activities with our interventions. For example, we are linking star rating of health facilities with the site improvement monitoring system. This is really increasing performance because it's really linked with what government is really doing. Next. Next. For the leadership and management, as EGPAF, we ensure that whatever we are doing is endorsed by Ministry of Health, regional and district leadership. We are also supporting RHMT to coordinate regional partners meeting, to coordinate partners in the region. We work with RHMT also to conduct joint supportive supervision to waste facilities and poor performing facilities. And we always build the capacity of new RHMT and CHMT members on project intervention. We also support monitoring and reporting, health information system, scale up of national reporting system. And we are also supporting council and region to conduct monthly and weekly data review meetings. Next. We are also engaging with community structures like council multi-sectoral ACE committees. EGPAF is a member of council multi-sectoral committees. These committees are responsible to oversee implementation of our interventions at community level. And we collaborate and orient them on various project interventions. And we support them to reach community with health needs, including HIV services. Another structure we are also supporting next is Health Facility Governing Committee. Next slide. We are also supporting or strengthening Health Facility Governing Committee, whereby these committees are responsible to ensure availability of quality healthcare services at facility level. EGPAF build capacity of CHMTs to be mentors and facilitators as well. And we're expecting CHMTs will be orienting these committees on their new roles and responsibilities. Next. We have some lessons learned for building local capacity. We learned that local capacity strengthening is a very dynamic process, and we need to invest over time. And the manpower and leadership at local authorities is dynamic as well, and is keep changing because today you will build capacity of RHMT, and next time you'll see that RHMT has been changed. Incorporating activities in CHP promote ownership, collaboratively working with RHMT through joint reporting, support supervision, help to build the leadership, and transparent during planning process, build trust and strong working relationship, and our alignment with a national strategic plan, really helping us to meet the national and project objective. Thank you.
Thank you so much, Jane, for concluding. I think what has been a very detailed set of presentations, really showcasing some of the great work that we at EGPAF are doing, bringing together people, institutions, resources, as well as activities to really, reach that primary purpose where we're promoting, restoring, and maintaining health. So we did not get much in terms of questions from you, our audience, but we will just go through some questions to really unpack further some of these discussions that we've had with our panelists. So I would like to prioritize Tate Maime with a question. I think just to understand, EGPAF has done quite a lot, as you've demonstrated, in terms of ensuring sustainability of some of the work that we're doing, for example, training of trainers, ensuring collective planning, as well as ensuring ownership. It would be interesting to hear from you what your thoughts are on what you as a recipient of TA can do to further sustain the gains of the TA provided. And with that, what are some of the additional roles that would be important for EGPAF and other partners as we work towards an AIDS-free generation? Tate Maime?
Once again, my email photo, as I've been mentioned. One of the thoughts that we would like to do as a facility, we would like to do step-down trainings of all the trainings that we received from technical assistant team, so that we capacitate most of our colleagues. And you would agree with me that if the information has been shared, it would be easy for implementation. So also we would like to use this TCA tool to assess ourselves internally on quarterly basis, so that even when EGPAF is not there, if we continue with those assessments on quarterly basis, it would help us to improve as an organization. And also, I mentioned that we have learned to develop a QI plan. If we develop our QI plans, we update them more often and implement whatever that has been said in the QI plan. That would help us a lot as an organization. And also develop projects in the areas that were identified not to be performed well during the assessments, internal assessment that we would be doing for ourselves. And also corrective actions on areas that have been identified that have been not performed well. So we would like to do corrective actions so that we improve in those areas. So for question number 2, which says what role would be important for EGPAF and other partners as we work towards an AIDS-free generation. We would like to our partners to help in scaling up viral load testing and reduce turnaround time. If viral loads are being done accordingly, it says we would identify patients with high viral load as early as possible, so that appropriate actions are being taken accordingly. And we would also like our partners to advocate from our Ministry of Health the yearly male circumcision policy, so that if there is a policy that says every new male born child is being circumcised, it says everyone would be circumcised according to the policy, and that would help us to reduce the cases of HIV, and that will give us a free HIV generation. And also, we would like to have a continuous support on patient tracking and retention of care, because you live with me that if we track our patients as early as possible, then bring them back to care, that would suppress the viral load, because we would be making sure that every one of our patients receives treatment and adheres well to the treatment that is being given. And the other thing, we would like to have a support on the availability of infant prophylaxis, more especially when it comes to high-risk infants. Because if these high-risk infants are being given prophylaxis appropriately, it says we would reduce the chances of them acquiring HIV. And also the PrEP for pregnant, scaling up PrEP on pregnant and breastfeeding women, as well as all eligible clients. That would help us to reduce the incidences of HIV. Lastly, we would like to have a collaborative effort from our implementing partners on activities to reduce frequent engagements to allow implementation. Because if we are having many partners that are supporting us, and they come more often to our facilities, that would not give us much time to be able to implement whatever the new information that we have learned, because there are many trainings that help us acquire more knowledge and skills in management of our patients. So if there can be more time that is being allowed for us, we would be able to implement whatever that we have learned so that we improve the quality of our services. By saying all that, I would like to thank you, the team.
Okay, thank you so much, Tate Maime. And I think it's really crucial for us as implementing partners, EGPAF and others who are in the room to really get those important insights from recipients of TA such as yourself. So to all of you who've come to join us, unfortunately, our time is up, but we really appreciate the time that you've taken to join us as we're unpacking the work that we're doing and really charting the way forward in terms of program optimization and local capacity strengthening towards health system strengthening. We look forward to continuing to collaborate with all of our partners, ministries of health, as well as, more importantly, the local communities and beneficiaries that we work with towards resilient, sustainable health systems and ultimately an AIDS-free generation. So thank you so much for your time. We will be sharing the recording as well as links to the important resources that we referenced, and we'll also share contacts of our panelists so we can keep the conversations going. Thank you so much.